I don't choose when I fall sick, but when I fall sick, I have an immediate cost. A woman that is diagnosed with cancer cannot choose to wait for them to have enough money before they can start treatment. Someone with heart failure cannot say, you know what, when I get enough money, I will start treatment. And in countries where people overwhelmingly have to pay out of pocket, and the drugs are so expensive, it's a life or death situation. People don't have the luxury to wait. Africa has some of the highest drug prices in the world, simply because it's a free pricing market. So you can take a single medicine and two pharmacies next to each other will sell that same drug at widely different prices. Besides that, the supply chain is highly fragmented. It makes it hard to standardize cost price of drugs.
Typically, my patients are hypertensives and diabetics who have to be on medications daily, and the markup on the medication is quite high as sometimes 80%. And it is very, very distressing.
It was through this that we realized that if we could begin to bring together all these independent pharmacies and remove the pressure that they have to face in sourcing their own drugs, we can begin to address the issue of medicine availability and affordability. So mPharma operates in 4 African countries: Ghana, Nigeria, Zambia, and Zimbabwe. We approach the management of the institution, whether it's a hospital, a clinic, a community pharmacy. We try to understand their internal procurement processes, and then we offer them the opportunity to outsource that aspect of their work to mPharma. The beautiful thing about the service that we offer them is that not only are we taking ownership of the supply chain, we are also providing the financing to purchase the inventory. And we offer them a simple value proposition: pay only when you dispense the drug to the patient. Beyond having the products available, we actively help them manage their inventory.
Zenat suspension, 100 ml 3.
We are very focused on building data pipelines, because fundamentally supply chain is not just a logistic problem, but it's a data problem. So we help them actually stock only the medicines they need to be able to serve patients that have those conditions. And by doing that, we help cut down on overstocking or understocking. One of the biggest areas where there's fraud, bribery, and corruption is procurement. Now we open the lid. We let hospitals know how much it costs to buy these drugs. And there are people who used to benefit from having that procurement power. And those people don't like mPharma.
The issue of drug availability was a major challenge for us. Today, through mPharma, we are able to get this medication and we're able to stock them. So at any point in time that patients walk into the pharmacy, these drugs are available. It was a major relief to us.
Na nia mepe was spring chemist ni say eduro bi a ope bia oba won sebeka na obetu eduro so a wo de prescription ni ba ye bi say so why test na say wunyeye enti say wunyeye a omo lab ho on be test so.
With the mPharma program, the complications of cardiovascular diseases have reduced because of the accessibility to medication. It is now cheaper, and then also they don't have to go pharmacy shopping to see which pharmacy stocks those medications.
What we hope is that with our focus on bringing down the cost of drugs, that there will be a systemic change, that even other actors will be forced to reduce their prices.
Have placed you on suspension Gaviscon to be taken at 10 mg 3 times daily. I'm sure the pharmacists have gotten your drugs ready for you.
Success begets more success. What I can do is to make mPharma successful and it inspires other people. to want to replicate that model. That's what we're working towards.